So we're still in the treatment of inmates with special needs under the Bureau of Jail Management and Penology Manual. So this will be the part 2. We're going to focus the discussion regarding the drug users or the drug dependents or alcoholics. So if in case it is because of the implementation of the Uplang Tokhang, they were able to be in jail or imprisoned, or I mean, yes, in jail, the appropriate term, uh, the BGMP manual said that inmates found to be drug users or drug dependents or alcoholics should be segregated from the other inmates, especially during the withdrawal period. So they are to be segregated for them not to influence the other inmates, no? During the withdrawal period, if we say withdrawal period, this is the time wherein the drug dependent will lessen the intake of drugs or during the time of removal, no? Because this is a process. So during the time of the withdrawal period, yun yung time na inaalis yung intake of drugs to the person who is a drug dependent, then they should be separated with the other inmates. Another is for those who are drug dependent, they are to be referred to the jail psychiatrist or the physician for evaluation and management also, because the psychiatrists and the physicians or the nurse of the jail are the appropriate ones who are going to conduct the evaluation and also for managing, no? Kasi they are the ones who are trained and sila din ang nakakalam on how to lessen or help the drug dependent to overcome the situation or to be rehabilitated. Another is the appropriate measures should be taken to enable inmates to follow strictly the jail physician's advice regarding diet and other medical interventions or treatments during the withdrawal period. Actually, inside the jail, may dietitian sila, no? Wherein their food are being checked. It must uh, they must follow the Go Grow Glow food. Also, with regards to the drug dependents or alcoholics, as one way of helping them is with regards to their diet or their food, which is being thoroughly checked. That's why uh, that's one way of helping them in the medical intervention, because there are some instances wherein some food contents are inappropriate to those who are undergoing with the withdrawal period. That's why they have doctors who specialize the diets inside the prison for them also to check those. So those are one of their tasks actually. And another is the maintain close supervision over inmates to prevent attempts to commit suicide or self-mutilation by designating a jail personnel trained to manage such cases. Uh, if we say drug dependent or drug users, actually, or mind you know, that the person who is a drug users or drug dependents has suicidal tendencies also. Maybe not all, but maybe most, that they have suicidal tendencies. That's why they really need close supervisions kasi nawala na yung drugs sa kanila eh. Some results of drugs sa kanila pag naka-drug sila is masaya sila, yung mga ganon. Ang tingin nila sa mga matatanda eh parang ang gagandang dalaga, mga ganon. So, pag nawala na yung effect ng drugs sa kanila, then doon na nila mafe-feel yung lone, yung pagka-loner nila. Doon na nila mafe-feel na they are not being loved by their family, yung happiness na nafe-feel nila if they are with the influence of drugs is wala na. So, doon na, they are in their real words, no? So, doon na sasagi sa isip nila na magpapakamatay na lang kaya ako para matapos na ito. So, that is one of their choice actually. They have suicidal tendencies. That's why maintaining close supervision to them is really a must, no? And also the regular search of inmates' dorm and maintain constant alertness to prevent the smuggling of drugs or narcotics and other dangerous drugs. Actually, with letter E, the conduct of regular search with the inmates' dorm is actually sometimes the contribution also of their family, no? Because inside the jail, they have this so-called uh, Dalaw program wherein the authorized relatives are going to visit the inmate and sometimes they are also the contributor with regards to the intervention. Kasi sometimes ang akala natin is, yes, nakakulong na siya so he or she or that person is undergoing rehabilitation. Pero pag pala dumadalaw yung nanay niya may dala-dala siyang mga narcotics or some other dangerous drugs, which is uh, not a good help to the person who is drug dependent, no? Kaya with the conduct of the frisking or the search inside the jail, they are very strict with the conduct of that, wherein they're going to, it is a must din talaga na head to toe, maghuhubad kayo. Even the private parts are being checked because sometimes they really put the some dangerous drugs there just for them to surpass the frisking or yung nasa is the notion of the community that ay private part yan, no? Pero minsan ginagamit nila yung private part just for them to uh, put narcotics or surpass the frisking, but it is being observed also by the jail officer, so they can also check the private parts of the visitors. So, yun, that's all about with regards to the drug dependence. But as to rehabilitation naman with the inside the prison, they have this so-called criminogenic risk assessment and classification. So, if in case you are drug dependent or drug users or alcoholics, then you will undergo this risk assessment and classification. If we say criminogenic risk assessment and classification, this is the process wherein the drug dependent will undergo the process for them to identify the best program or the suited program to that certain drug dependent. And the programs, or I mean the program to be given unto them is the drug rehabilitation program. This program is for those who are drug dependents also. So they're going to study why is it that such person or that particular person uh, is using drugs and the reason why. And if in case the result had shown that this certain person is a drug dependent because uh, he or she is not educated and she does not know, and it is because of peer pressure, because of being lonely, and just to escape the loner of being a loner, and he or she will use drug just to escape those feelings. So they can give them or they can use the educational program of the jail like the IELTS just for them to divert the attention also of the drug dependent. That is one way of helping them to be rehabilitated. So those are the ways, and these are the basing on the manual rules. So the letter A, B, C, and D are based on the manual rules and policy manual of the or the BGMP manual to be specific. And with regards to the intervention, it is also based on their DIWD manual. So those are some ways for the jail officers or the government is for the government to help the drug dependent inmates. So that's all. If in case you have any questions or clarifications with regards to the drug dependence, discussion with regards to drug dependence, feel free to ask through our chat box or through our group chat, or you can send it via private message. So that's all again with this part 2. Thank you, and I hope you have or you had understand.